Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back to Open Your Eyes. This, of course, is the first segment, and it comes courtesy of Fulltech Systems, our COVID-19 update. Now, yesterday we heard in the news that we are actually with variants in our country. It is now confirmed that we've got variants in our country, about 4 of them. So what we've done is that we've invited 2 doctors in to tell us exactly what these variants are, what it means for our country, and how we could eventually prevent from making it continue to spread. In with us, we've got Dr. Mark Musa. He's an internist. He's a gastroenterologist at the Belize Medical Associates. Good morning, sir. I like that shirt, by the way. That's a nice one.
Thank you.
And Dr. Hidalgo, internist at Belize Healthcare Partners Limited. Good morning as well, and welcome, guys.
Thank you.
Thanks for having us.
Alarming news. And I say this because we've been saying it ever so long that we need to continue to protect each other. We need to continue to adhere to the social distancing protocols and whatnot. So much so now that it has been confirmed that we've got variants in our country. When it comes to variants, we know the transmissibility rate is very high, especially with Delta. Let's start with you. Dr. Musa. What does this mean for our country? There are 4 variants in our country. What does this mean?
So the variants of concern, the 4 I think identified are the Epsilon, the Alpha, the Delta, and the Gamma. The main one that is very concerning, if you want to rank them, is the Delta. And I think 9 out of the 20 or so positive cases were positive for Delta.
Yeah.
But as doctors, we have been seeing a change in how the virus has been behaving for the last 2 to 3 months, since maybe the beginning of June. And we have noticed that it is far more infectious and easier to spread. And for every positive case that has been identified, you find that on contact tracing, more people have been infected. So it's felt that the Delta variant is at least 2 times more infectious or transmissible than the original variant. So that's the main concern, that it is so easy to spread. That makes it very important that we continue our preventative measures, or wearing of our masks, following physical distancing, avoiding overcrowding, and then to get the protection of the vaccine. We have the opportunity with the vaccine to add additional protection against severe disease, hospitalization, and death. So we cannot be putting pressure on the vaccine so early, because we still have such a vulnerable population. I think only 33% of persons have had at least 1 dose, and I think 13.5% are fully vaccinated. Now, I think we are doing reasonably well in terms of, if you really look at it, starting the full rollout of the vaccination, when it became available to all 18-year-olds, was only in June of this year. At that time, we got a donation, I think, of 100,000 AstraZeneca from Mexico, and then it was rolled out to all persons 18 years or older. In fact, when I checked the statistics over the last 5 to 6 weeks, I think they only have about 3,000 to 5,000 AstraZeneca vaccines left from the Mexico donation. So that means over 90,000 doses have been delivered in 5 to 6 weeks. So it is very important, not that I think that they have been averaging about 2,500 vaccinations a day. That is very good. I think we had more a problem with access to vaccines rather than confusing it with vaccine hesitancy or anti-vaxxers and things like that. So it is very important to realize that none of these 2 main tools should be used. They should be used together. We can't say, oh, the vaccine isn't working because it's not preventing spread. The vaccine isn't designed as a barrier to spread. The barrier to spread is human-human interaction. We are spreading it amongst ourselves. So it is how well we follow the protocols that will get control of the spread. You can't vaccinate yourself out of a surge. So we have to be patient. We have to allow persons the opportunity to get the vaccine, but we also have to be following the protocols and be very strict, because this one is far more easy to catch. And all of us will at some point be exposed to it.
And that is the concern.
Yeah.
So let's take a moment, because I know when the release came out yesterday, we'd all been talking about Delta for so long internationally. Delta is the headline grabber. But people have questions about the other variants that have been detected. Epsilon, Gamma, and there's Alpha and Delta. So when you look at the origins, that's one thing to look at. You can look at the trends that they saw when they had their outbreak. But what do we know about these individual variants so far? Let's start with Gamma. That was the one that was predominant in Brazil.
Well, once again, thanks for the invitation. And as I think so, all of us been telling you guys since and in this forum that this virus and the nature of every virus is to survive, is to live. I mean that whatever we do, they will find a way how to survive. And one of the ways that the virus survive is that they are constantly mutate. And mutations, one of them could be basically passed inadvertently. Some others are going to take like in this one, the direction of the virus and take, we can say, command. And then we've been seeing since the very beginning, the original SARS-CoV-2 virus, after a couple of months, was different. And now, of course, in December, we have, in September, actually, was the first variant in the UK reported, but actually, actively in December, we see the news, the Alpha one. And of course, after that, we see the surge of cases that we see in Brazil. And of course, it was in some areas was completely devastating, because in each type of circumstances, these variants were more transmissible.
Which means they're easier to catch.
More easier to catch. Some other, we say, more virulent. That means that can make people sicker. And of course, if we say we have more people sick and more people, then the possibilities of mutation are there. And of course, Brazil, they fighting, and they have at that point a very, very difficult situation. And of course, we start to notice, as you remember, at the very beginning of the pandemic, we were more concerned about the vulnerable population. That means people with medical conditions and over 60 years old. But then when we see the new variant, especially the one in Brazil, we start to notice that other people on younger age with no medical background, they became sick and also ended in ICU. And of course, with mortality rates that higher than at the beginning we noticed.
And it was in Brazil too that we saw children being hospitalized for COVID. That was a concern coming out there. Is that from the Gamma variant?
At the beginning. Now, of course, with the Delta one, then we see the trend more constantly. We see more people in the 20s, 30s, and 40s being admitted in the hospital. Also, it's very difficult to see someone basically young in a young age, very ill in ICU, and of course, it's more difficult to see how they die.
So that's what we know about Gamma so far. Any other things that the public needs to understand about this particular variant?
Well, as we mentioned, each variant has his own particularities, and of course, as we mentioned at the beginning, the Alpha that is more transmissible. The Gamma that we see that can affect a wide range of population, no discrimination. We can put it that way. But of course, as Dr. Musa mentioned already, our main concern right now is the Delta variant, because it's more transmissible, 60% more than compared with the other ones. if we can say a person with chicken pox,
Yeah.
you see someone, this one is comparable with that, because if I'm infected with the Delta variant, I can infect 8 to 9 people
Wow.
at the same time. I mean that also the transmission time is shorter. With the initial variant, we say our transmission rate start at 6 days or more, but with the Delta one is less, 4 days.
We saw that at the onset of the pandemic, and I think people are still doing it right now. They would clear offices if there was a breakout here, let's say per se, and we're supposed to, or there was a breakout somewhere. What they do is that they clear that office and they do it for a few days. This was at the onset of the pandemic. I think a few people are still doing it right now. But at the onset of the Delta, we know now that Delta is in here. What about the lifespan of that disease? Now, if we should clear out a spot, it was once a few days, would we still recommend that we continue for a few days, or should we elevate the amount of days we should be out of that office?
Well, I think there are a couple of points with that question in terms of, I think that office or that building should, for example, if you have this office and you have multiple floors here, it might be that you might say, well, I will start my contact tracing on this floor, and you do contact tracing for the close contacts of whoever was the index case in that, or the first case in that office. It's important that when there are concerns about the rapid test accuracy in terms of picking up asymptomatic mild cases. So we have to then utilize PCRs to then truly determine if somebody who has been in close contact with a positive case, if they are truly negative or not. So the rapid test is still important to use as an initial screen. If it's still 50-60% accurate, that means that, and you identify, that means those persons have been identified as positive. They have to go into isolation. But I wouldn't then say that's the end of your contact tracing. You should then go on and test the PCRs in persons who are close contact, household contacts, the direct workplace where you work closely with people, and definitely the symptomatic. Because you will miss cases if you don't do that additional screen with the PCR. Now, you cannot again put the PCR and say, well, why don't we do PCRs on everybody? Because we might end up where we were last October, where we were waiting 2 weeks for a result of the PCR, and then the persons really needing the PCR who are in Karl Huschner and things like that. So we have to be very tight with the protocols. And it is important that if you are tested, and you are tested both with the rapid and you test negative, and they do a PCR, that you go home and isolate for 5 days until that result comes back. Because there have been cases where people say, well, I tested negative, and I went back to work. And then 3-4 days later, the PCR comes back positive. So if you have been tested as a close contact and a PCR has been sent, you need to isolate and wait on your results. Make sure you don't develop any symptoms. Make sure your office has been sanitized. So I would say, yes, it's the close contacts. That section of the office needs to be closed for a period of time, 5 days, a week. Make sure good contact tracings are done before reopening.
Now, I hear very often where you talk about this high transmissibility, and you even mentioned that the progression is faster, that you identify faster than we once were talking about earlier, I should say last year. Now, Minister of Health, Michelle Shabat, did note, I think, in contact tracing that where before you would have had a positive case and maybe 1 or 2 people in the household would have gotten it, and now they're finding the entire household has it. Explain to us what that means for people who are isolating at home, or people who may feel even mildly sick at home, what they should be doing to protect the rest of the household.
Well, as Dr. Musa mentioned already, as soon we noticed or we are suspecting that we get in contact with someone, we need to be essentially self-consciousness in that case, and we need to make a decision to isolate ourselves. And of course, to protect the family and also to protect the close contacts. If we know our risk, what we need to take the different measures and to say to lower our risk. If we know that I have any particular condition that make me more vulnerable, then I need to make a conscious decision on that. And especially, or if I'm living with someone with a medical background and I get in contact with someone that is being tested positive, then we need to make that decision to isolate ourselves and also whatever person in the family that we are suspecting that get in contact with them as well. But most important than anything, we need to get in touch with the different lines that are available for the Ministry of Health. That way we can also get guidance. We can, as you see, we can describe the symptoms, and they can also give some advice as at what moment we need to go to the hospital to seek medical attention. That is important, because the earliest we can, if I became sick, the earliest I can get medical attention, then it's going to be more beneficial for me rather than wait until it's too late and end in an ICU with less chances.
Dr. Hidalgo, is it common? Is it common for viruses, especially like this one? We know that coronavirus is something that we've found a long time ago, but this just so happens that this is a different strain. Is it common for viruses to mutate like this?
Just and I also discussed it in a previous interview, and I say we have 6 different types of coronavirus, but this one in particular is have many situations that we need to see. One, this virus is too big. A normal RNA virus is usually the size is like 10 to 11 kilodaltons, and this one is 25 to 30. I mean that you see the huge amount. Also, if and by nature virus mutate. This particular one, if we think that this huge size of virus, then he will mutate in a certain way that he will commit suicide by itself. But the virus is too smart, this one, that have an ability to control the mutations. And that is making this virus more basically dangerous than the other ones. And that's the reason why we insist that we need to take all the different measures, our different social distancing measurements, and get vaccinated if you have opportunity. Because as the more people are exposed to the virus and more people are sick, then the chances of other mutation, we are right now concerned about the Delta. But tomorrow we will concern to other one, and as in the last time Dr. Musa mentioned, we are concerned of those type of variations that could be essentially of highly consequence. That means that we are not going to be able to detect it. It's going to be highly lethal. Those are that we are basically trying to prevent to reach that stage.
I'm glad you mentioned that, because there is a benefit in Belize with being kind of behind the global curve of how things happen, because we can see what's happening and where we're not necessarily paying attention and learning from the lessons. We at least know what to anticipate. In the US, for example, they're starting to talk about Lambda. They're starting to talk about, as I noted before, children being hospitalized. So there's almost a predictor of what can be for Belize. But coming back to the issue of variants that may come up, of all the variants that have been identified so far, what I hear mostly is more transmissible. Are there any new variants that have been identified that are more severe in how they impact the body?
Well, there's a concern about the Lambda variant, that it is not as that's the variant that first was detected in Peru at the end of last year and spread, I think, to Chile, Colombia. There is a concern that that isn't as transmissible as the Delta variant. And in fact, there's some Lambda in the United States, but you might find that You might say, well, why isn't the Lambda, if it's a little more deadly than the Delta, why isn't it
A bigger
doing
deal.
more damage?
Yeah.
Well, there's something called viral dominance, where the most infectious one is the one that pushes the other viruses aside. And so that is what is happening with the Delta versus the Lambda, the Gamma, things like that. If you notice, all of these variants have started in large populations, highly dense cities, in largely unvaccinated people at the time. So the surges have been astronomical in terms of its ease of transmissibility, in that it is naive to everybody who has never faced this virus before, and so it has, and the quicker the virus spreads, it has more chance to mutate, its genes to mutate, and then, so the initial concerns with the Delta is it's more transmissible.
Yeah.
There will come a time when, if we allow the spread to go unmitigated, that there's a concern whether the vaccines might not offer the protection, and that the virus causes mutations that make the vaccines less effective. Now, that has definitely, with the Delta variant, the vaccines, persons who are fully vaccinated are still getting breakthrough infections, but in the vast majority, it's mild symptomatic disease. The concern is, even those mildly symptomatic, fully vaccinated persons have to view themselves as being transmitters of the virus as well. So your job as a fully vaccinated person is not over.
Yes.
Your responsibility is not over, because you have to also continue to practice your preventative measures
Yeah.
in order for you not to aggravate or worsen the transmission of the virus. So if you look at somewhere like United States, we should never compare ourselves with the United States. We don't have their resources. We don't have their millions of vaccines. But you can say that their lifting or their guidance was purely based on information on the UK variant, the Alpha variant, and the original strain. So they have lifted wearing of masks. You see large crowds of people in concerts, at basketball games, things like that.
All sporting
And
Yeah, seeing those pictures, it's just unreal. Especially knowing what we're still doing here.
but that shows that they are now referring to their pandemic as a pandemic of the unvaccinated.
Yeah.
Because you're then seeing that the vaccine, a 60-year-old who has been fully vaccinated might have diabetes, might get a breakthrough infection, but get a mild form. The concern now is that you're seeing younger and fitter persons getting hospitalized, going into ICUs, going on a ventilator and dying. And the vaccine, it's then too late. You hear so many testimonials of them saying, can you please give me the vaccine now?
While they're on the
It's then
bed.
too late.
Can I just get the question in, the conversation about the Delta Plus now? What is that?
I think that's just a variation of that they find that even with the Delta variant, that they have had additional genetic or mutations that make it even more transmissible. But you often hear people say, well, why are we making a big deal about a mortality rate of 1% or 2%? Well, it's because of how many people will be affected. It is 1% of what number? If it's 1% of 1 billion infected people, that's significant.
Of course.
If you compare it and say, well, Ebola virus, that has a 25% mortality, meningococcal meningitis has a high, but the sinister nature of this virus is that the asymptomatic, it has a long incubation period. It has the asymptomatic or the mildly symptomatic can be transmitting and not even knowing it. So more people will be affected or infected. So that 1% becomes significant if 1 million people are affected. If in Belize, 200,000 or half our population is affected, 1% mortality rate makes that what, 2000?
Yeah.
So with Ebola or these other things, the persons get ill very quickly.
Yeah.
Yeah.
They go in their bed
Yeah,
and
they
they're
don't even have a
sick.
chance to
They don't
spread
even
it. They
know-
die so
ex-
Yeah,
quick.
exactly. Yeah. At
They-
the onset of the pandemic again, it was said that children between the ages, I think, birth to about 2 or 3 years old, they don't have to wear a mask. Now we have detected these variants in our country, about 4 of them. Would you say that they're now supposed to wear a mask, especially with the transmittability rate of the Delta variant?
Well, that's one of the things that also we say that the people need to get vaccinated. Of course, it's difficult to put a mask in a child that age, you know, to trying to keep in, and that's the reason why we say if we are basically continued with this trend that we don't want to get vaccinated when we are put all this population at risk, not only the children's but also the vulnerable people, all the other different people with other different medical backgrounds. I mean that's the reason why we insist that we need to continue our social distancing, the measure that we know. And unfortunately, is like the same history of putting your seatbelt over and over and over, and you're still seeing people dying and in an accident because of they don't want to wear the seatbelt. Same thing, over and over. You need to wear your mask, but wear your mask properly. You're still seeing after more than a year of the pandemic, you see people with the mask over below the nose, not covered properly, don't wash in the hands. All those simple things that have been proved effective. And one of the things simple to prove that the measures are effective is because you see the flu season. You basically don't see the common flu as usually seen in other years, just doing the simple things. And that helps us to the initial phase of the pandemic. I mean that those measures, we need to continue reinforcing those type of measures.
Yeah. You know, the point that you mentioned earlier about the fatality rate of 1%, you know, I think I appreciate breaking down the numbers to look at how many people would actually lose their lives to this disease. But for us, it's even worse because Belize has consistently, since the start of the pandemic, had a higher average fatality rate than most other countries. In other words, more people die from those who get infected of COVID-19. Do we understand, and you guys as medical professionals will know best, why is that?
I think there are a couple of factors. I think you have to look at your ability of testing.
Okay.
If you look at our second wave or surge from October to February of last year, at the start of it, we were predominantly using the PCR. So at one point, that became very inefficient, and we weren't testing enough. And so identifying your positive cases, there might have been, say, 50% more people who had a mild form that were so your denominator, what you're dividing, is actually, so that is called a case fatality rate. Because you divide by the documented positive cases. So I think Belize, if we have 341 deaths, I think we have about 14,500 identified cases. I think that's a significant underestimate because you might not have been identified. That shows you
Those are
the strength.
reported cases.
Yes, exactly.
Yeah, reported. But our fatality rate is almost double the global.
Not really. If you look at the case fatality rate of the global, there has been 4 million, say 300 deaths. There have been over 200 million documented cases. So that puts it at 2.1%. So we have a 2.34. Let me compare, looking at the raw numbers, let me compare Trinidad and Jamaica, their experience to Belize. In January, Jamaica had approximately 250 deaths. They started to open up, and they have been going through a continuous surge. Their that total today is over 1,200.
Wow.
And that is likely not even with the Delta variant. They are now having to face the Delta variant, having had an additional 1,000 persons dying between January and now.
7 months, yeah.
And just today, they are going into serious lockdown mode
Yeah.
again. Trinidad, again, in March, had deaths less than 200. Today, they are over 1,100.
Wow.
They were facing the variant from Brazil and the UK variant. They now have to face the Delta variant. So in Belize, between March and August, we've had 27 deaths. We got to 300 very quickly. And that's why it's important that the vaccination plays an important role, because we have to look at the numbers. If we are seeing concerning numbers, hospitalizations going up, we have to encourage persons to bring down the transmission by following the guidance. We need targeted measures by the government. If we see Belize City over the last 4 weeks, every day getting 30 positive cases,
Identified.
then there has to be measures for Belize City.
Yeah.
Yeah.
I want to get to that, to talk about the response that may be necessary at this time. But since you did bring up Belize City, one of the factors that I think we don't talk about, and it's been discussed before, that the south side of Belize City is of concern. But I would say it's many different communities experience this. Some of the households are just bigger. They're bigger with more people in a smaller space. And so your transmission rate can be much higher in these types of circumstances. Now, we can't change people living circumstances. I wish we would, but what's your advice? I mean, this is where a lot of the transmission will take place. Even if I have my mother protected at home, I go to work, I may bring it back to her, or one of the other 5 people in the house may.
Yeah, I think people have to start taking personal responsibility. And I think if you are a young person, you have to view yourself. You might say, and although the evidence is showing that, you might say, well, my risk with this virus is minimal. That's not showing in what's happening in the unvaccinated young people in the States and in other places, that the vaccine offers so much more protection at saving your life.
Yeah.
So you have to then look at it that the vaccine is additional. You might say, well, I am a fit person, I take care of myself, that's good. But you also have to realize that you can be a transmitter of the virus to your household, to your vulnerable parents or grandparents or wife or whoever.
Yeah.
So you have to then look at yourself as a spreader as well. And so your decision also has to involve whether the vaccination cannot be a selfish decision. It's not just about you. This isn't an individual disease. This is being spread by human to human contact.
Yeah.
And I know people have concerns. It's very good to ask questions, get all the information you needed.
Yeah.
But it cannot be that I just don't feel like take it. I want to be in a control of everything that's going on in my body. That's fine.
Yeah.
But this is a different disease. You are part of, we all have to view ourselves as potential transmitters of the virus and follow the guidelines, but protect ourselves, protect our loved ones, do it for your family, do it for your community, do it for your country.
Yeah.
All right.
Yeah.
So this is definitely a two-part segment. Dr. Musa is in with us, Dr. Hidalgo is in with us as well. And we're so glad that you're able to break down what it is like, especially living now with these variants that have been found in our country. We know that you've got some questions as well. We'll take a break. It is a two-part segment like we mentioned. When we come back, we'll be asking some more questions. Stay with us. We'll be back.
Whether you're at home, on the road, at work, or at school, if you see news happening or suspect that something might be up, call or text the Channel 5 News Belize tip line at 672-5555. You don't have to give us your name, just give us the tip. That's 672-5555. Call or text us so we can check it out.
And we're back, and we are continuing our conversation. Of course, yesterday there was official confirmation from the Ministry of Health on something that we already knew, which was that most likely the Delta variant was circulating in the country. And with that confirmation, we've taken the time to get Dr. Hidalgo and Dr. Musa with us to help to break down the information so people can understand and get the questions answered. One of the things to set the backdrop before we move into our viewers' questions is that while yesterday's report from the Ministry of Health talked about the number of cases identified with specific variants, it is important to put it into context that these samples were sent out about six weeks ago.
Yeah.
So I would say, or you can tell me, we'd guess that it is far more persons with Delta variants, each one of these variants in the country at this time.
Well, we usually say that in circumstances like that, we usually need to act as the worst case scenario. No? I mean, that I think so. The way we're trying to advise population is that, and been saying over and over that, even that is not what were confirmed, we knew based on the clinical cases and the tendency that more likely Delta was here for a while. No? And we were acting and advice based on that information, trying to act as the worst case scenario. And that's what we've been doing. You know, of course, right now with confirmation, things change a little bit. But just to say, we've been discussing that with Mark and the other part of the group that we need to act based on the worst case scenario.
Yeah, and I appreciated that from the time the variant was detected, while we didn't have the confirmation, the messaging basically was, it's most likely Delta, it's most likely Delta. Let's get into some of our viewers' questions. So one of the things, and I know this is a common question that you get.
Yeah.
So if Christina wants to know, if I got vaccinated, will I be safe against these new variants?
With the Delta variant, for example, if we look at the AstraZeneca vaccine, the AstraZeneca vaccine is still extremely effective, over 90%, 92% effective in a fully vaccinated person at preventing severe disease, hospitalization, and death. For any medical treatment, that's an A+. When I go to school, if I get over 90, that's A+.
Yeah.
So the starting point is it is effective at saving your life. One dose at preventing the serious complications is about 70%.
Okay.
What has significant? No, you can't just. You have to allow the immunity to build up, and it builds up over a few weeks after each dose.
Yeah.
And so we are currently recommending 8 weeks for the second dose, but somebody is considered fully vaccinated at 10 weeks, 2 weeks after their second shot. So the vaccine works at the severe end of the spectrum, at saving your life, preventing serious complications, and ending up in the hospital. There has been a drop-off at preventing transmissibility because of how infectious the Delta variant is. So the overall effectiveness of the getting infected with one dose is only 30%. It goes up to 60% of developing symptomatic disease, which is with 2 doses. So that means mild or even asymptomatic persons detected on contact tracing. So that 60% includes prevention of asymptomatic, mild to the severe spectrum. So that has been the drop-off because of how infectious or easily transmitted the Delta variant is. Even with the Pfizer vaccine. Initially, they were over 90% effective at even preventing transmission. They have noticed a drop-off in their ability to prevent mild infections to about 60-70% fully vaccinated as well. But they are still effective over 95% of preventing the Pfizer at preventing severe disease and death.
So let's stay on this topic, because one of the questions is looking at the vaccines that are available in Belize and that have been administered. So AstraZeneca is one. The Sinopharm, and I know we're expecting both Pfizer and the Johnson & Johnson vaccine. What about, how do they compare against the variants?
The Sinopharm and which other one?
The Johnson & Johnson.
Okay. The Johnson & Johnson is a one-dose vaccine, which uses a similar platform like the AstraZeneca, which uses a viral vector, which is a milder virus, using the genetic material of the virus and introducing that to a person, and that genetic material, the RNA, first and foremost, that does not interact with the human DNA. Okay. Our human DNA is protected inside the nucleus. The RNA cannot get into the nucleus and interact with your virus, with your DNA. So the RNA then goes into your cells and takes over and sends a message. Please make the spike protein so that I can then build immunity to the spike protein, which is the little attachment receptor that makes the virus stick onto cells and invade your cells. So that is the way it's trying to mount a controlled immune response by using the vaccination to introduce a controlled production of the spike protein so that you can build your own antibodies in a controlled way, and your body isn't overwhelmed by uncontrolled infection.
Yes.
Just to add, as you see, as you mentioned, there are several vaccines with different platforms. But just to put it in a simple way, each vaccine and each platform, essentially, it will give your body the necessary resources that if at some point you became infected with the virus, the body will have the ability to fight the virus. I mean that, of course, as we mentioned, there are different platforms that they use, but all of them are with the same idea and the same concept, that it give you the body the ability to have the resources to fight the virus when you get in contact with them.
I always like to tell people when we talk about immunity, imagine a little army being built inside you to fight off the opponent.
I think for that Johnson & Johnson, the answer to the question is it is about 85% effective at preventing severe disease. With one dose. With one dose. You're considered fully vaccinated. No, they are talking about whether they will need a booster at 8 months or things like that.
Here.
So, but that's the Sinopharm and the Sinovac, which are inactivated. This is the old version of vaccines. Okay. Like the old polio vaccine is a inactivated, weakened virus, where it can't infect you and cause uncontrolled disease, but it can still mount an immune response. That is the platform that Sinopharm, Sinovac uses. So
Alana wants to know, how long does the vaccine last, and will Belize start giving boosters soon since the increasing numbers? Now, the second one is a Ministry of Health question, but the first one is talking about the effectiveness and how long.
Well, we are still collecting data on that. Approximately, we can say probably 6 to 12 months. But of course, basically we are still building data on that. And as we mentioned also the last time in terms of the boosters, what we are saying right now, we need to try to make the effort that everyone gets the first dosage, especially those that are not getting it, and those that already got the first dosage, trying to get the second dosage. we are in terms of the booster. What is being discussing is that probably the initial group of people that it will get it is those that are with some medical background and the more vulnerable one, and it's something that is being doing in all the countries. Of course, we still not know at this stage how soon and when this booster is going to be recommended, but at least some of the discussion is that probably more likely those that are more vulnerable ones.
Can I just say something about the boosters? If you listen to WHO, they are discouraging first world countries to give boosters. Because if you look at the distribution of the vaccines, the 50 poorest countries have only received 1.1% of vaccinations. The 20 richest countries have received over 50% of the vaccination. That is a recipe if we continue like that. Southeast Asia is a breeding ground for more mutations.
Yeah.
They are densely populated, they are unvaccinated. As a global pandemic response, the WHO, PAHO are trying to encourage countries to donate to COVAX to get the majority, because we will be going through this vicious cycle.
Yeah.
If we don't get
Because if a
everybody
mutation
vaccinated.
pops up in these unvaccinated, populated areas
yeah.
that doesn't work with the vaccine, then we're back to, March 2020. That's what it feels like.
Yeah.
Some, at the point where we are right now, some, especially when it comes to frontline workers, they've been asked, you know what, in order for you to come on in, you need to be, especially if you're an anti-vaxxer, you don't want to be vaccinated, then you need to bring a test in every so often. But they're also saying that some folks, you might not be able to get the vaccine because of underlying conditions or what you're suffering from. What would be some of these, what would be some of the things that you might be suffering from that would prevent you from getting a vaccine?
The only contraindication to get the vaccine is if you have a documented allergy to some of the components of the vaccine. That's the only one that we can say.
So, okay. So if we go in and say, you know what, doc, I'm suffering from such ailment, and, then you would recommend you're not able to get the vaccine. What would be some of those ailments?
Again, so far, what we've seen, and most of the people are coming to get advice to get the vaccines, and unless if you are, or especially with the Astra, if you are probably receiving anticoagulation treatment because of an active clot, then we say that should be one of the contraindications. But most of the time, the only say is if you are allergic to any of the components of the vaccine. I don't know, you want to add something?
Yeah, I think it's important. I think persons with comorbidity, if you have diabetes, if you have high blood pressure, cardiovascular disease, if you've had a stroke, if you have some immune compromised condition like lupus, rheumatoid arthritis, that you are on immunosuppressants, in fact, the vaccine is more beneficial to you in terms of the level of protection. And the question more is, that's where the boosters come in. Because if you have a lower level of immune response to the vaccine, it might be that these higher risk groups might need a booster 6 months, 8 months, 12 months down the road as a start. But in terms of protection, if you face COVID unvaccinated and you have these comorbidities, including age, if you're over 60 and you have these medical conditions, you will be far more protected than if you're vaccinated than you're not. And so that offers even more protection in that high risk group.
Heavy skepticism also comes along with hearing from friends or family members what happens following taking the vaccine. Is it normal for a reaction following taking a vaccine, like feeling a little ill, probably some soreness? Is that normal?
Yes, well, one of the things, as everything we do, if you take an aspirin, you can have a reaction. I mean, that the same thing with a vaccine. You can, if you have a vaccine, most of the time you will have, most commonly, but not necessarily, but most commonly, the major symptoms is pain in the site of the injection. Probably for a couple days you will feel muscle ache, tiredness, and in some cases you can have a spike of fever for a day or two. That is something that is expected and this is most commonly seen.
So let me get to this question
Sure.
here. What is the best way to protect our unvaccinated children, especially the ones that have underlying conditions?
Well, first of all, they have not even been given, particularly the under, well, in Belize, the under 18 are still very vulnerable. So the preventative measures, both for themselves, but you as a family, and what you expose the child to is very important. It's important that everybody in your bubble or your circle are vaccinated so that that reduces, it doesn't eliminate the risk of transmission, but it significantly reduces. And the importance of explaining to, now the big question about school and things like that is a significant thing. Now,
Well, that's one that
That's
they're
one of the
asking
questions
right
that we
now.
have,
What's
yes.
your advice on face-to-face school?
I personally would say that there are worrying trends in Belize right now with the Delta variant and the increase in cases. And if you look at the three scenarios, if you go back to full face-to-face learning, a hybrid system where maybe half students go in and half go online and things like that, or fully go online. My personal opinion would be to start online. We are hearing that we should get a donation of the Pfizer vaccine, which is licensed and has been used in the 12 to 18-year-old group. That's a significant portion of our, that's high school and sixth form and tertiary education there. That still leaves the primary school vulnerable.
School, yeah.
But I think, and if it's the Pfizer, you can be fully vaccinated or get your 2 doses in 3 weeks.
Oh, wow.
It is not the 8 weeks. So if that is a real possibility, I would advise that we should at least start there. Offering the Pfizer vaccine to high school, sixth form, and they are the ones actually who should be more versed at accessing online and internet. Now, there is always the question about does everybody have equal access to the internet and things like that. But I would say in terms of risk, we should at least give ourselves the opportunity in that group to get as many vaccines available if that donation comes through. The younger group still remains, and they will have to, I think the primary school, again, they are younger, but I would still think that they have, at this point, no possibility of getting any protection from the vaccine. So I would say, because we have rising numbers with a very infectious virus, I would say they should start online again. And that would be my advice.
Yeah, I noticed you said very clearly a personal
Your
opinion.
personal, yeah.
It's a tricky situation.
Yeah.
We know how children have been suffering, and we know that there is a need for children to return to classrooms, but is it the right time? And that's a question I'm sure the Ministry of Education and Ministry of Health have to ask themselves. I want to get to some of the measures that we do have in place, but before we do, we have one more question on eligibility for vaccines. Can people with asthma take the vaccine?
Yes, and as we mentioned before, and Dr. Musa mentioned, the patients which have some comorbidities, again, we repeated again, diabetes, patients with kind of rheumatoid arthritis, lupus, patients with asthma, even we discussed about also, I need to mention that the pregnancy patients, because pregnancy, it can put you in additional risk and more vulnerable to ending in an ICU. Also, those populations are the ones that definitely they need to get the vaccine more.
Yeah, yeah. So let's come back to the measures. I know that both of you are consulted very often by the Ministry of Health in looking at They say they're following the science, they're taking guidance. Dr. Musa, you have spoken out before on decisions that the government has made in reopening the country or allowing persons in. Do you think it's time for us to implement stricter measures than what are currently in place?
I would say if you're following the numbers, just like what happened in Midway and Santa Elena in the Toledo district, where you saw a small village, but they got quick control by going in and doing a strict lockdown for 2 weeks, 3 weeks, and supporting that community, making sure you're testing everybody, isolating and quarantining persons, and supporting them with food and a stipend and things like that. Now, the concern to me is the Belize district, or the Belize city. And it has been consistently, you're getting 30, 40 positive cases a day. I think a targeted increase in restrictions for a 2 to 3 week period, just to get a handle of the transmission, would be my advice. And that may be in the form of say bringing up the curfew to 8, say go back to take-out dining in restaurants, closing the casino for 3 weeks, that type of behavior. Because people might say, well, the virus could travel during the day as well.
Oh,
no?
we hear that all the time.
I mean, but it's the type of behavior. I mean, if you want to take a drink for that 3 weeks, please do it in your house.
You can do it in your house.
Yeah.
I know even interactions within the workplace, that's something you have to look at, where you take off your mask or who you take off your mask with.
Exactly. That's, as I always say, the pandemic and the coronavirus is a social responsibility. We cannot put everything to the government. Of course, the government, they need to do what they did, but we have also, as an individuals, be responsible in the way we act and in the different areas of how we conduct ourselves. No? And again, back to that, we need to make sure now to be very strict, wearing our mask, make sure that we are in a ventilated room, trying to avoid crowded gatherings and all those things. No, right now it's important that we observe and follow that recommendation that we are over and over saying, but that we've proven that are working.
I think as well we underestimate that the vulnerability of our health system, and we have healthcare workers, lab techs, public health inspectors, nurses, doctors, who have been going at this for 18 months. Those people are under major stress. They are mental, physical, they face burnout. We need to help them as well. And so if you follow the numbers, I think targeted increase in restrictions where the number applies, because this thing can go south very quickly. It can go, so you might say, well, the deaths tend to follow 6 weeks, 2 months down the road. But once you have seen, that is too late. It's too late then.
We're at 16 active hospitalizations reported now. We don't know the number of persons who are awaiting confirmation from PCR tests. So we know that we're getting to that point that was more than our healthcare system can handle.
And of course, back again on what we saying at the beginning in terms of our health system is not strong enough, and also we don't want to see the ICU soon overwhelming on cases, and we are essentially incapable to handle it. No?
Wow.
Now let me ask if one of the things yesterday in the cabinet brief was that they are exploring the option, the Attorney General is exploring the options of mandatory vaccination. What's your take on this?
I would recommend mandatory is compulsory is different than mandatory or encouragement. I personally think that we're not doing badly. I would not pick any fight with anybody right now. I think we need to access more vaccines. We need to answer persons' questions, legitimate questions. But at some point, you might, I think it's way too early to be rewarding vaccinated people and lumping everybody who has not been vaccinated so far as anti-vaxxers and things like that. I think most persons can be encouraged if their fears, if their concerns are discussed and allayed. And so I think it's too early to go that way. To me, I think we should get more vaccines. If we are continuing to vaccinate 2,500 persons a day, there might come a point where you reach a sticking point.
Yeah.
But where if you reach 70% of policemen and you can't get the next 30, then that's where you say, look, you want the right, your right to work also infringes on the government or the police department ensuring a safe workplace and your ability to transmit the virus and things like that. And so that's where the testing comes in, and you can't just say, well, and it's my right to refuse it and I have no responsibility, not even to bring in a negative test. But I think we're not that, to me, I don't think we're doing that badly in terms of if we can consistently answer people's concerns, getting more vaccines, getting more access to other types of vaccines like the Pfizer. I don't think we're at that point yet.
You said something, and let's expand on that just a little bit here. You said that you can't take the unvaccinated people and lump them all together as anti-vaxxers. And that, in fact, is one of the things I think we should explore. Anti-vaxxers are different from people who are hesitant to get vaccinated. Do you want to explain that?
Well, I think so. I usually say it in this way. You know, we have these two different groups. Of course, one that essentially are trying to have this type of fight. We are fighting right now two situations. We are fighting the pandemia, and we are fighting the infodemia. This type of misinformation and misguidance that at the end of the day, it will take all these people basically to a hospital and dying. And of course, they have the other group that they are hesitant because they have probably a valid question, because probably they have a medical background and they say, okay, I would like to wait. Basically, what we are saying for those type of people that are hesitant, that please go and seek for medical advice. If you have, we've seen several everyday people that came say, you know what, doc, I want to put the vaccine, but I have A, B, and C questions that I would like for you to go through and answer and facilitate. And that's we advise them and trying to explain what is the scenario. The other thing is, you know, that and we see that since the very beginning of the pandemic, that you don't want to get your vaccine that have properly documentation is basically being on trial, and we know the safety of that. But yes, you want to get a kit of medication over the counter that you don't know what you are getting, but then because they say, okay, this is a kit that brings A, B, C, and D medication that will prevent you to get the coronavirus, and those things are not proven. No? You know, you have something that is proven and something that is not proven, but people want to go into that direction. I mean, that I say, let's seek medical advice for the questions you have in case you want to get vaccinated, but you are afraid.
And we've seen that in the questions, even the ones asked today. I mean, people ask, you know, if I have asthma, can I get the vaccine? If I have thrombosis, can I get the vaccine? If I have seizures, can I get the vaccine? So they're genuine concerns versus just an absolute stance against vaccinations.
Yeah, and I think we have to be careful when we watch the TV and don't compare ourselves with America or Europe or things like that. I still think, in reality, the vaccine campaign, the vaccination campaign truly started July the 1st, when all phases were opened up. And even those persons who got it, you cannot vaccinate 100,000. If I get 100,000 doses today, you physically cannot vaccinate 100,000 people
in one day.
In one day. So we have to be patient. Those people getting vaccinated on July 1st will get their second dose September the 1st, roughly.
Yeah.
We're not, if we are saying, if 95,000 doses have been given in 6 weeks, that is not anti-vaxxers. So I think
So you
we
feel
have
that
to,
the uptake has been positive?
I think so.
Okay.
Okay.
Now let's come back to something else, because you mentioned it, and it is also, I know, a concern that vaccinated people have shared, where they feel that we have, made the decision to do the right thing, proactive about taking the vaccine. We should be rewarded and be given passes and free paper, essentially, to move around. And hey, France is doing it, other places are doing it. What are your thoughts on this for Belize?
I think so. As we don't have the luxury and also those health systems very strong. No? I mean, I think so. We are not in that position at this stage. No? And I don't know if we are going to be at some point. No, but I think so. Get vaccinated is a responsibility, a social responsibility, and I think so. That is part of us as a society. We need to contribute. And we don't expect to get reward for something that is my responsibility.
Yeah, I would agree. I don't think it's the right time. I don't think we've fully rolled out the vaccine long enough to say that I have offered and we're stuck at 50% for 3 months and we're not moving anywhere, like what might be happening in the US. So I think the vaccinated for now, you need to be reassured that your reward for now is that if you likely contract the virus, you won't end up in a hospital, you won't develop severe disease, and you won't die. The other things about whether I can go to a nightclub and things like that is really, in the greater scheme of things, not important at this point.
All right.
And let's just take the opportunity, though, because I think it's we haven't really talked about things like symptoms. So people may not know that they have actually contracted this particular variant, and the symptoms have changed.
Yes, we've seen a different trend of symptoms that are more unspecific. No? I mean, that you can probably have a headache at the beginning, probably you can have a muscle ache. Sometimes we can have patients with gastrointestinal symptoms, diarrhea. I mean that the presentation and the symptoms that we are seeing right now are more, we can say, atypical, are not the classic symptoms that we have at the very beginning.
Yeah, because first we were looking for high fever and shortness of breath and a dry cough.
Yeah.
I think, recently, and I think it's almost like some of the symptoms like the common cold, runny nose or obstructive sinus problems, things like that. The other aspect as well in terms of the change in symptoms is I think people are deteriorating quicker in terms of the ones that are unvaccinated in hospital, even if they are young and have no comorbidity, you see them running into problems quicker. In the past, you might have gotten a little sign that your oxygen level is slowly dropping. This is happening much quicker. And the theory behind it is that the Delta variant is so infectious that it replicates so rapidly that it achieves a viral load that overwhelms your system much quicker than the original variant or any other variant. So as medical doctors, we have to be very careful.
Well, that actually was my next question, because in the first and second wave, one of the message coming out from the medical community was, don't take some symptoms for granted, get to the hospital quickly. Like the minute you start feeling that extreme fatigue or shortness of breath, go to the hospital or call Ministry of Health, because you could be on the brink of very severe COVID. What do we say are these triggers now, especially given the context you just explained?
Well, it's basically, as we mentioned at the beginning, if in case you get in contact with a patient that you knew that had COVID, and you make a decision to isolate yourself, then trying to get immediately in touch with your family physician or the Ministry of Health, and then call them and inform them that you will get in touch, and then you will get a call every day to find out about your symptoms, but also if you notice that something is changing, then you need to call them and seek medical attention as soon as possible, because of course the time and also the behavior of this Delta virus is more aggressive, more different, and then you can get into serious illness soon and needed to be hospitalized sooner than in the previous cases, in the previous waves.
Are we still worried about our elderly population with Delta if they've been vaccinated?
Yeah.
Yes, I think that's the concern why you hear of persons of whether that group will need boosters, because their immune response might not be as robust as a younger person in terms of the level of protection or the level of antibodies they can achieve. So that's why they're looking into trying to see if boosters are needed a little earlier for people who are over 60, people who have the high risk conditions that we mentioned before. So the immune system of an elderly person is not as robust as a young person.
Yeah.
So
And
that
how is it that people in their 30s are passing away from COVID now? It seems from the Delta variant. What is it, just because they're unvaccinated? What's the link?
Well, the Delta virus, as we are seeing, is most also virulent. Also have some of the mutation have the ability to escape our immune system defenses. Mean that the way this virus is behaving is more aggressive, and then that's why we see that younger people, especially those that are unvaccinated, are more vulnerable. Also, is more aggressive. It makes people sicker more quicker, and then probably if we are in the 30s or in the 40s, I can probably say, okay, I can fight that.
Yeah.
And then probably say, okay, I can stay at home and I will take more longer to seek medical attention.
Yeah.
And then when you reach to the hospital, you are really, really in a bad condition, and you end into the ICU. And the time frame that we have to act, we don't have that luxury.
Yeah. So they actually act at a later time.
Yeah.
Because they feel youth probably.
Among other things.
Yeah, among other things.
I
Okay.
think if you
Go ahead.
if you were going to compare, say we were discussing earlier off air, United States and say England. United States has, say, roughly a little over 50% fully vaccinated. But they have gone the other extreme where they have removed all the physical distancing, the wearing of masks. So it becomes a percentage thing. The young people have a higher of gatherings and socializing. In England, they have a 70% vaccinated coverage, but they have been slower to lift the restrictions. So they have gotten much quicker control of their Delta variant surge than what America is facing.
Wow.
And so the young person, I mean, even in Belize, we have had a few cases where you might see, I think 3-4 weeks ago, we had a 23-year-old with no comorbidity, was very unwell on high flow oxygen, and she had to be admitted for a week. But she was in trouble, and luckily she got the right treatment and she pulled through, but she was unvaccinated. We hear of a 35-year-old unvaccinated person who succumbed the last few days. Yet you hear of families who are fully vaccinated might get mild infection, including the 60, 70-year-old with diabetes, and they have the vaccine is working in that group.
Yeah.
So the vaccine protection will become the single most determinant of how you fare against the virus.
Wow. Big statement.
Yeah.
Dr. Musa, Dr. Hidalgo, we're so grateful that you guys could have joined us this morning to break down how things are, especially with the detection of these 4 variants. Thank you so very much for joining us, both of you.
Thank you for the
Thank you.
invitation.
Wow. All right, so we're about to take a commercial break. When we come back, we've got our final segment for you. This one is all about the first back-to-school art competition for special needs students. We can't wait to hear about it. We'll be back in a few to share that with you. Stay with us. We'll be back.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.